Hi, good afternoon. My name is Hao Sun. I'm the co-founder and CEO of CureLynx, and we're building an AI chatbot for clinical trial recruitment and retention. So, yeah, we started as two close friends working on this project back in May of this year, and we're united by the same mission, which is connecting patients to life-changing clinical trials. We believe every patient deserves the chance to deeply understand their condition and find treatments that align with their specific needs. If we're successful, our solution can change the lives of millions of people around the world who are in need of cutting-edge therapeutics. So currently, 1 in 10 Americans are diagnosed with a rare disease, according to the National Institute of Health. And most of these rare diseases have no known cure, and they negatively impact the patient's quality of life. And patients right now have to rely on their physician, their caregiver, or themselves to find appropriate clinical trials. They struggle with navigating a system that's loaded with medical jargon and has numerous handoffs. But our chatbot can talk to the patients in their own language, to their own literacy level, help them understanding their prognosis and recommend trials based on their specific criteria. And during the trial enrollment period, it can also act as a patient companion tool. So the tech underlying our solution is a large language model, ChatGPT-4, trained on healthcare domain knowledge. And we're building safety guardrails, so we'll always provide factual answers to questions related to clinical trials. For collaboration, we're partnering with clinical trial sites and patient advocacy groups. We'll also keep human experts in the loop to ensure that we deliver the highest level of safety and constantly iterate our model with human reinforcement learning with human feedback. And for our product launch, we plan to launch in poorly served areas first, where providers may lack knowledge of appropriate trials for the patients. And these patients also tend to be underrepresented in current trial populations. So yeah, currently our chatbot is able to interview the patient and find relevant trials. We're building multi-language support, so we're starting with Spanish and Chinese other than English first. And it's able to discuss risks and benefits of each trial. And at the end, it drafts the intro email to the trial coordinator. But in the near future, we plan to integrate with EHR. And once the patient consents to sharing that data, we can screen for eligibility and automate the entire informed consent process. And during the trial enrollment period, our chatbot, CureLynx, becomes an electronic data capture system, and not just data capture, but also it's able to support psychosocial needs of the patient as well. So you can imagine maybe the patient needs transportation needs, and we can connect them to Uber. And maybe they need mental health support, and our chatbot can support that as well. So it's a really seamless experience, and we imagine that retention rate will improve as a result. The current global market for contract research organization, or CROs, is valued at $45 billion annually, and that's $10 billion in the US alone, and it's estimated to grow at 8% annually. Our competitors include traditional CROs like Parexel, PPD, IQVIA, as well as other startups like Power, HealthMatch, Modern Trials, and TrialSpark. But what sets us apart is that we really deliver an end-to-end solution that's able to automate the screening, identifying, and consenting, and retaining the patient. So it's a really one-stop shop solution for the trial sponsors. We offer our product for free to patients, and we'll partner with providers to reach those in need. And our focus is on reducing recruitment timelines and costs for the trial sponsors. So currently, trial sponsors have to spend about $8,000 per patient just for recruitment. And the patient drops out, the replacement cost is $20,000 per patient. So Initially, we aim to reduce that by 50%, but I think maybe 5 years from now, we can reduce that by 10x. For our revenue stream, we'll reach out to pharmaceutical companies and biotech companies who need to recruit for rare disease patients and charge per service per patient. And because of there are so many emerging breakthrough technologies in biology and computation like CRISPR, like AlphaFold, more biotech startups will emerge that's focused on rare diseases. So we foresee there will be a growing demand for patient recruitment services. And for our funding, we will apply to renowned incubator programs like Y Combinator, and we're also planning to raise financing from top investors. This is our team right now. So my name's Hao. I'm the CEO, and I'm a physician by training. And my co-founder, his name is Jeevan Grawley, and we've known each other for about 7 years now. And we started actually at a different company building a symptom checker chatbot. So we have quite an experience in building these interfaces. Yep. So that's my pitch, and time for questions. Thank you.
Thanks, very interesting. Quick question. At what point in the recruitment process does this get introduced? Because how does a patient know to go and have a conversation?
Yes, really good question. So right now we're reaching out to clinical trial sites. So for example, I live in San Francisco, so I'm just reaching out to UCSF. They have a patient relationships department. It's focused on recruiting patients, right? So we'll offer our service product for free. Just say, try this product, and we'll talk to the patient and discuss the risks and benefits of each trial, educate the patient. So that's how we're starting to get some user traction.
Okay, so it's about automating existing channels.
Yes.
Yeah. Okay.
Yes.
Cool. Thanks.
Yeah.
So, are you sending any of this data to third-party LLMs or foundation models?
Yeah. So we're sending embeddings to ChatGPT-4, but we're not storing that data. We never use our patient's data in any other way other than just for that interaction itself.
Any other questions? Okay. And I do want to just add a comment that we do have time at the end of the day when our winners are going to be able to interact also with the VCs and judges and kind of at the end of the day. Just so as we move through quickly through the questions, we do have the goal of making sure our startups get to connect.
Are you leveraging a generic genetic model? And so what's your core tech? Is about prompt engineering to make it a more suitable for
yeah. So our core tech,
recruitment?
I think it's not taking into multimodal data yet, but I think that may be a future as well. So being able to ingest genetic data, analyze genetic data, but but our core tech right now is prompt engineering as well as building these safeguards. So it reduces the amount of hallucinations and only provides factual answers.
I'm curious about your business model. You mentioned for free to the patients and these sites.
Yes.
Have you talked to the ones who will actually be paying, which is, I understand, will be the biotech and the pharma companies? Who have you spoken with? What do they like, or what are their concerns about what you're doing, and what would compel them to pay for it?
Yeah, so these are still really early conversations. We haven't entered into any business agreements with any biotech companies, but we're focused on building safety first. So we know that our product will always be high quality before actually, selling it.
Okay, thank you.
Given the nature of the engagement you have with patients here,
Yes.
then the likelihood is that patients are going to be providing you with DHI of some description.
Yes.
How are you preventing against leakage of that DHI back into baseline LLMs or into other aspects of the ecosystem?
Yeah, that's a really good question. I'm not perhaps, best equipped to answer that because, our CTO, he's more knowledgeable about building these secure systems. But yeah, thank you.